Chapter 2, Role of the Government in Health. In a democracy, people expect the government to work for their welfare. This could be through the provision of education, health, employment, housing, or the development of roads, electricity, etc. In this chapter, we shall examine the meanings and problems related to health. Look at the subheadings of this chapter. In what ways do you think this topic is related to the work of government? What is health? We can think of health in many ways. Health means our ability to remain free of illness and injuries. But health isn't only about disease. You may have associated only some of the situations in the above college with health. What we often ignore is the fact that each of the above situations is real to health apart from disease. We need to think of other factors that affect our health. For example, if people get clean drinking water or a pollution free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or behave to live in cramped condition, they will be prone to illness. All of us would like to be active and in good spirit in whatever we may be doing. It isn't healthy to be dull, inactive, and anxious or scared for long stretches of time. We all need to be without mental strain. All of these various aspects of our lives are part of health. Healthcare in India. Let us examine some of the aspects of healthcare in India. Compare and contrast the situations expressed in the first and second column. India has the largest number of medical colleges in the world and is among the largest producer of doctors. Approximately 15,000 new doctors qualify every year. Most doctors settle in urban areas. People in rural areas have to travel long distance to reach a doctor. The number of doctors with respect to the population is much less in rural areas. Column first. Healthcare facilities have grown substantially over the years. In 1950, there were only 2,717 hospitals in India. In 1991, there were 11,174 hospitals. In 2000, the number grew to 18,218. Column second. Above 5 lakh people die from tuberculosis every year. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number isn't decreasing. Column first. India gets a large number of medical tourists from many countries. They come for treatment in some of the hospitals in India that compare with the best in the world. Column second. We are not able to provide clean drinking water to all. 21% of all communicable diseases are waterborne. For example, diarrhea, worms, hepatitis, etc. Column first. India is the third largest producer of medicine in the world and is also a large exporter of medicine. Half of all children in India do not get adequate food to eat and are undernourished. In order to prevent and treat illnesses, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. that can provide the required care and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat illnesses. We also need the medicine and equipment that are necessary for treating patients. These facilities are required to take care of us. India has a large number of doctors, clinics, and hospitals. The country also has considered experience and knowledge in running a public healthcare system. This is a system of hospitals and health centers run by the government. It has the ability to look after the health of a large section of its population scattered over hundreds of thousands of villages. We will go into more detail on this later. Moreover, there has been a phenomenal advancement in medical sciences whereby many new technologies and treatment producers are available in the country. However, the second column points out how poor the health situation in our country is. With all the ever positive developments, we are not able to provide proper healthcare facilities to people. This is the paradox, something that is contrary to what we would expect. Our country has the money, knowledge, and power with experience but cannot make the necessary healthcare available to all. In this chapter, we will look at some of the reasons for this. Public and private healthcare services. From the above story, you must have understood that we can roughly divide up various healthcare facilities into categories: public health services and private health services. Public health services. The public health service is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems from common illnesses to special services. All the village level there are health centers where there is usually a nurse and a village health worker. They are trained in dealing with common illnesses and work under the supervision of doctors at the primary health centers (PHC). Such a center covers many villages in a rural area at the district level in the district hospital that also supervises all the health centers. Large cities have many government hospitals such as one where Aman was taken and also specialized government hospitals such as the ones in Hakim Sheikh's story. The health service is called public for many reasons in order to fulfill its commitments of providing health care to all citizens. The government has also established these hospitals and health centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to government as taxes. Hence, such facilities are meant for everyone. One of the most important aspects of the public health system is that it is meant to provide quality health care services either free or at a low cost so that even the poor can seek treatment. Another important function of public health is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. This has to be organized by the government with the participation of people, otherwise, it is not effective. For example, when taking up a campaign to see that mosquitoes do not breed in water cooler rooftops, etc., this has to be done for all houses in the area. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. The government must safeguard the right to life of every person. The court said that the difficulty that Hakim Sheikh had to face could have cost him his life. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. The court who said that it was the duty of the government to provide the necessary health services, including treatment in emergency situations. Hospitals and medical staffs must fulfill their duty of providing the necessary treatment. Hakim Sheikh was denied treatment at various government hospitals. Therefore, the court asked the state government to give him the money that he had spent on his treatment. Private health facilities. There is a wide range of private health facilities that exist in our country. A large number of doctors run their own private clinics in the rural areas. One finds registered medical practitioners (RMPs). Urban areas have a large number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. There are many laboratories that do tests and offer special facilities such as X-ray, ultrasound, etc. There are also shops from where we buy medicines. As the name suggests, private health facilities are not owned or controlled by the government, unlike the public health services. In private health facilities, patients have to pay a lot of money for their service that they use. Today, the presence of private facilities can be seen all around. In fact, now there are large companies that run hospitals, and some are engaged in manufacturing and selling medicines. Medical shops are found in every corner of the country. Healthcare inequality, inadequate healthcare available to all. In India, we face a situation where private services are increasing but public services are not. What is then available to people are mainly private services. These are concentrated in urban areas. The cost of these services is rather high. Medicines are expensive. Many people cannot afford them or have to borrow money when there is an illness in the family. Some private services encourage incorrect practices to earn more. At times, inexpensive alternatives, though available, may not be used. For example, some medical practitioners are found to prescribe superfluous medicines, injections or saline when simple medication may suffice. In fact, barely 20% of the population can afford all the medicines that they require during an illness. Hence, even for these whom one might not think as being poor, medical expenses cause hardship. It was reported in a study that 40% of people who are admitted to hospital for some illness or injury have to borrow money or sell some of their possessions to pay for the expenses. For those who are poor, every illness in the family is a cause of great anxiety and distress. What is worse is that this situation tends to happen again and again. Those who are poor are in the first place undernourished. These families are not eating as much as they should. They are not provided basic necessities like drinking water, adequate housing, cleaning surroundings, etc. And therefore are more likely to fall ill. The expenses on illness make their situation even worse. Sometimes it is not only the lack of money that prevents people from getting proper medical treatment. Women, for example, are not taken to a doctor in a prompt manner. Women's health concerns are considered to be less important than the health of men in the family. Many tribal areas have few health centers and they do not run properly. Even private health services are not available. What can be done? There is little doubt that the health situation of most people in our country is not good. It is the responsibility of the government to provide quality health care services to all its citizens, especially the poor and the disadvantaged. However, health is as much dependent on basic amenities and social conditions of the people as it is on health care services. Hence, it is important to work on both in order to improve the health situation of our people, and this can be done. Look at the following examples. The Kerala experience. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to panchayats. They could plan and provide for their requirements. This made it possible for a village to make sure that proper planning was done for water, food, women's development, and education. This meant that water supply schemes were checked, the working of schools and anganwadis was ensured, and the specific problems of the village were taken up. Health centers were also improved. All of this helped to improve the situation despite these efforts. However, some problems such as shortage of medicines, insufficient hospital beds, not enough doctors remained, and these needs to be addressed. Let us look at an example of another country and its approach to issue of health. The Costa Rican approach. Costa Rica is considered to be one of the healthiest countries in Central America. The main reason for this can be found in the Costa Rican Constitution. Several years ago, Costa Rica took a very important decision and decided not to have an army. This helped the Costa Rican government to spend the money that the army would have used on health, education, and other basic needs of the people. The Costa Rican government believes that a country has to be healthy for its development and pays a lot of attention to the health of its people. And the Costa Rican government provides basic services and amenities to all Costa Ricans. For example, it provides safe drinking water, sanitation, nutrition, and housing. Health education is also considered very important, and knowledge about health is an essential part of education at all levels.